Hello, and welcome to part one of the lymphatic system and your immune system. We are going to go through the first half of this chapter in this video. The second half of chapter 22, we will go through in the next video. So when we're talking about our lymphatic system and our immune system's role is to fight different pathogens. A pathogen is any kind of microbe, whether it's viruses, bacteria, fungus, parasites, that are going to cause some sort of disease in the body. Your immunity is your body's ability to actually fight off whatever viruses, bacteria, any kind of those microbes that get into our system. How your immune system can actually fight that off and keep you healthy or return you back to being healthy. Susceptibility. How easily can you get sick? How easily or vulnerable are you to different pathogens? We have two different types of immunity. We have innate immunity. This is what you're born with. These are different defense mechanisms. They're going to protect you either in general, or we're kind of given to you. We have adaptive immunity. Adaptive immunity involves lymphocytes specifically, that one type of white blood cell. They can specialize, learn, and remember specific pathogens or microbes, or different foreign substances for that matter too. Our immune system works with our lymphatic system to make all of this possible. So we'll start with the lymphatic system, and then we'll go into exactly how the immune system works. So we have several different structures or organs in our body that make up part of this lymphatic system. There's different types of lymphatic tissue that are found in lymph nodes, that are found in the spleen. We have different lymphatic vessels that somewhat resemble blood vessels, but we will look at how they are different. These lymphatic vessels, we have that interstitial fluid that sits outside of our cells. Lymphatic vessels will help to maintain that correct balance of interstitial fluid. It'll drain out excess interstitial fluid, and that's when it becomes lymph plasma or just lymph. Then those lymphoid tissues are those different lymphatic organs or structures, like lymph nodes. Everybody's heard of lymph nodes, I'm sure. They are made of reticular connective tissue. This reticular connective tissue, back from the tissues chapter in chapter 4, we find that in our lymph nodes. We'll find some of it in our spleen. This is specific tissue specific to the lymphatic system. So let's start looking at some of these different lymphatic organs here. We have tonsils. We have palatine tonsils, submandibular tonsils. Tonsils are part of your immune system and your lymphatic system. Anytime we see nodes, like cervical node, those are lymph nodes. We have a right lymphatic duct, and we have a thoracic duct. We mentioned the thymus in the endocrine system. The thymus works mainly with the immune system. Any long, stringy green things that we see here, those are lymphatic vessels. Here's another one of those thoracic ducts. That thoracic duct is going to travel back up and it drains here. We have a cisterna chyli, intestinal nodes that are also known as Peyer's patches, your red bone marrow, because your red bone marrow is what makes your white blood cells, axillary nodes, that spleen, here's more aggregated lymphoid nodules, iliac nodules, inguinal nodes. These are all different lymph nodes. So this video here, you're logged into Wiley, you can click this video through the PowerPoint. It'll open up into kind of going over the lymphatic system here. So the functions of that lymphatic system, as I had already mentioned, it's going to drain excess interstitial fluid. So if too much fluid collects between the tissues, that's what causes swelling, and those tissues are known as edema. Your lymphatic system comes in and drains that out, gets rid of it. So our system can keep that balance of having just the right amount of water outside and inside those tissues. Your lymphatic system is actually what transports fats from your digestive canal to the liver. So our fat-soluble vitamins are A, D, E, and K. They're going to travel in that lymphatic system. And then, of course, those immune responses. So lymphatic vessels, just like blood vessels, have specific characteristics. We have lymphatic vessels all over the body, just like we do blood vessels. We have lymphatic capillaries, just like we have blood capillaries. The lymphatic capillaries drain into lymphatic vessels. They just get larger and larger and larger, just like veins per se do. The big difference is they're extremely permeable, which means large molecules can actually go right through that lymphatic vessel inside and travel within that lymph fluid. So proteins, lipids, and even things slightly larger than that, because proteins are long chains of amino acids. These long chains of amino acids can get right through the lymphatic vessel and travel where it needs to in the body. Here's the interesting part. In a lymphatic vessel, it's one way. Things can get in, but they cannot get out. So once we absorb that interstitial fluid, it's in there. It's stuck there. It doesn't go out. We kind of create this door that allows this lymphatic or this interstitial fluid in and stays there. So it can get in through, gets drained into the blood eventually and gets filtered out. So these lymphatic capillaries, they draw them in green so we can distinguish them between arteries, capillaries, veins, and then lymphatic vessels. These lymphatic vessels are going to drain. They're going to take all this interstitial fluid, the fluid between the cells, the excess interstitial fluid, proteins, different things it's going to drain in. And then it's going to just travel up the same way veins travel up. So we go from these lymphatic vessels, this lymph, this fluid, it's going to go through different lymph nodes. There's going to be lymph nodes along the path that these different lymphatic vessels are going to follow. These different lymphatic vessels, after they go through lymph nodes, they turn into lymphatic trunks. They're either going to go, because they're getting larger and larger once they go from those lymphatic trunks, before they drain into our blood, there's only two ways they can get into our blood. It's either through the thoracic duct or the right lymphatic duct. These are the two places that lymphatic fluid drains into our blood, goes through the heart, goes to the kidneys, and gets filtered through to get rid of any excess fluids, any wastes that may have been collected. The cisterna chyli is just an enlargement, and it's going to receive the lymphatic fluid from both of our legs. That's where that cisterna chyli comes into play. That thoracic duct receives all of this lymphatic fluid from the left jugular and left subclavian trunks. It's going to open the thoracic duct, empties into these subclavian veins. I'll say that again, because that is we're going to see that somewhere. The thoracic duct eventually will empty into that subclavian vein before it goes to the heart. So here we can see everything in green on this image here. That is everything draining from that thoracic duct that goes into that subclavian vein. Everything in kind of beige tan, that is receiving that right lymphatic duct. And we can see how that right lymphatic duct is coming down towards that superior vena cava before it enters into that heart. So you can see there's technically on the right side, there's a lot more blood vessels coming through, but here's the thoracic duct. We can see how it comes into that subclavian. Here is technically that right lymphatic duct. It's coming in right at that junction of the jugular vein and that subclavian vein. It's coming in right at that junction that leads to that superior vena cava. So this lymphatic plasma gets formed because in the blood capillaries, we tend to filter out quite a bit of fluid, but we don't reabsorb all of it back. We reabsorb some of it, enough of it to keep the blood fluid, but we don't absorb all of it back in. So this excess fluid gets picked up by the lymphatic system. It turns into that lymph plasma that makes its way back to the heart. We have proteins that we carry through our lymphatic vessels. These proteins are too large to fit through capillary, like blood capillaries. So they're able to get in through lymphatic capillaries. So there travels in the lymphatic system that eventually drains into the blood. So some of our proteins, that's how they actually get to the bloodstream. The same way we use those respiratory pumps and those skeletal muscle pumps that we talked about in the blood vessels. The lymphatic system works the same way. We have lymphatic vessels also contain valves. So these valves come together, lymph goes up. These valves prevent lymph from going back, and those skeletal muscles, whenever they contract, we're pushing not only the blood from the veins up, we're pushing lymphatic plasma back up. So these are all kind of working together to allow lymphatic fluid to make its way back to the blood system, the circulatory system. So fluid tends to start in that interstitial fluid. It'll travel to the lymphatic capillaries, it'll diffuse, it'll use active transport or secondary transport, it'll use different ways to get into that lymphatic system. Those lymphatic capillaries absorb most of the stuff. It'll drain into lymphatic vesicles, which go to, or vessels, they go through lymph nodes, then they're going to go to lymph trunks, lymph ducts, and technically they're going to enter into the subclavian veins that drains into that superior vena cava that is going to empty into the heart. So our different lymphatic organs and tissues. Red bone marrow. This red bone marrow, back from chapter 19 when we talked about blood cells, that's where all of our blood cells come from. We keep stem cells in our red bone marrow that'll make not only our red blood cells, all the different types of white blood cells, as well as those platelets. So red bone marrow, the cells that pertain to our immune system, we have immunocompetent B cells and pre-T cells. These are different types of lymphocytes. Our thymus, that is most active when we're a child. And then this thymus, as we get older, kind of atrophies away. But our pre-T cells go to the thymus. They get into the bloodstream, they go to the thymus. The thymus is going to mature T cells. They get matured. They're going to become immunocompetent T cells in the thymus. T for thymus, B for bone marrow. That is where they mature. That's where they differentiate into what types of specific cells they are meant to be, is they are labeled based off of where they mature. So we mentioned the thymus and the endocrine system, and I said we would cover it more in the lymphatic system. So here we go. That thymus, it's in that mediastinum. It kind of sits on top of and slightly above the heart, in that middle area between the lungs. It technically has two lobes to it. It's got connective tissue wrapping around it. It's got a cortex and a medulla, just like other organs do. This cortex, we have T cells in that cortex. We have nodular dendritic cells, other immune cells, macrophages, and then we have immature T cells. These are cells that haven't differentiated and matured into what they're supposed to be yet. So these nodular dendritic cells, they come from these monocytes, and they're going to help T cells mature. There's a whole selection process of how these T cells mature. Our bone marrow makes a lot of these immature T cells, but in the process of maturation, only 2% survive that process. Only 2% can prove themselves enough to stay how they're supposed to be. The macrophages, those are the ones that can phagocytize. They come in and engulf, eat up, kind of break apart different things and spit it back out. So these macrophages are going to clean up all these dead and dying cells that did not survive the maturation process. The medulla. These have more mature T cells. We have more nodular dendritic cells. We have more macrophages. We even contain some epithelial cells, because these epithelial cells are going to turn into corpuscles. These are T cell death areas. T cells are going to leave the thymus. They're going to kind of migrate around. They go to lymph nodes, the spleen, and they get stored there until it is time to fight specific infections. But that thymus, as I mentioned in the endocrine chapters, and I mentioned before, is that we get older, it atrophies. When it atrophies, it becomes smaller. It doesn't work as efficiently as it did when we were children. So all of the T cells that were stored in that thymus will leave the thymus and they will go travel to another lymphatic organ and make that their home until it's time to fight specific infections. So this thymus here covers this whole area throughout. It's got these two separate lobes to it. It maintains and stays within this area, and it works hard to make T cells that can fight off specific infections. So here is some slides of a thymus. Here's a thymic corpuscle where T cells would go to die. We have that medulla, that cortex. We even can see some of that capsule on this view. So some of our secondary lymphatic organs, those lymph nodes, the spleen, and then those lymphatic nodules. Lymphatic nodules are just larger masses of lymphatic tissue. They're not large enough to be considered a lymph node. They're just, or they don't have the same like features as a lymph node does. They're just kind of an enlargement. It has its own capsule of connective tissue around it. We have them spread out throughout our gastrointestinal tract, our urinary tract, reproductive tracts, and our respiratory airways. Why? Think about it. These are all areas that have openings to the outside. So we need these in that area to help keep us healthy. We also have them near the mammary glands, the axilla, and the groin. They all have some sort of trabeculae throughout. This trabeculae kind of gives it these lymph nodules its structure. The parenchyma of these different lymph nodes. We have that cortex on the outside and the medulla on the inside. So they're kind of separated out. So when we have other dendritic cells, again, in our lymph nodes. Of course, we need immune cells in there because as this lymphatic fluid is going through these lymph nodes or nodules, we need to clean out any potential pathogens that may be floating through their lymphatic system. We also use our lymphatic system to transport around our immune cells. So these dendritic cells, what happens is these dendritic cells come in with some sort of microbe or pathogen, and they kind of hold it up in the air, present it to the different cells that are staying in that lymph nodule. It kind of presents it out and kind of says, hey, who knows how to kill this off? We house a lot of different B cells. These B cells can develop into plasmacytes and memory B cells. Memory B cells are going to remember coming across specific types of infections. These different bacteria, viruses, pathogens, microbes that come into our system, they usually have some sort of antigen. An antigen, remember back from the blood cells, is a cell marker. Has some sort of cell marker on them that identifies that cell as itself to them. But in our system, we recognize it as foreign. These memory B cells, if there was a memory B cell that killed off this specific pathogen in the past, it'll remember that it killed off that specific pathogen or microbe, and it'll activate itself and go out and kill out this pathogen because it remembers how to do it. These memory B cells are going to remember all of this, and we save these memory B cells to remember how to kill all of these, any virus or anything you have come across. Your immune system remembers how to kill all of it off. We don't get rid of those cells. They do not undergo apoptosis. They are not destroyed by macrophages because we need to remember how to kill off the common cold. We need to know how to kill off, which is common cold is different rhinoviruses. If you've had COVID, your immune system remembers how to fight it off. So on the inside of these lymph nodes or nodules, in that cortex, we have T cells and those nodular dendritic cells. Because those dendritic cells are going to present. When they present some sort of antigen within that lymph node, B cells become those memory cells. T cells, on the other hand, they will start to proliferate. So they will divide rapidly. And these T cells are going to travel to wherever this infection might be. And they're going to produce an antigenic activity. So they're going to break down these whatever cells are there to fight them, or whatever microbes are there? The medulla, those B cells. We have antibody producing plasmacytes and macrophages. So again, we've got storage of all of these different cells to help us remember how to get rid of certain pathogens that may have entered our system. When lymph flows through a lymph nodule, it can only come in one way and out one way. That's where those afferent is in, efferent is out. So those afferent lymphatic vessels are transferring information or transferring that fluid into the lymph node. They're going to go through sinuses, subcapsular sinuses, trabecular sinuses, medullary sinuses, efferent lymphatic vessels. So they're leaving now. They exit out the hilum. So here's this lymph node. We have a model in the lab that looks just like this. So it shows the cortex, it shows the medulla in the middle. We have an inner cortex. We have an outer cortex. So there's a lot of different cells that either just sit in here and wait for a specific pathogen or microbe to show up. Then all of this lymph fluid that is passing through here is being monitored for any kind of pathogens or microbes that it may find. When those dendritic cells will take those and present them. So here's more of a lymph node. You can see either through the electron micrograph on the right or the left with the light microscope, all of the different areas of that lymph node, that medulla. You can see the different types of tissues. You can see that trabeculae, those kind of lines that come down. We have that outer cortex, inner cortex. You can see the different shades of the tissues to kind of show that what different cells are sitting in those different areas. Another secondary organ would be the spleen. This is the largest lymphatic organ technically that we have. It contains different areas where it has white pulp and what is known as red pulp. White pulp, we have a lot of lymphocytes. We have macrophages, and they're kind of wrapped around the splenic artery. The red pulp has different sinuses. We have splenic cords of red blood cells, macrophages, lymphocytes, plasmacytes, and granulocytes. Remember that lymph node, or no, that spleen, sorry, wrong organ. That spleen helps to clean out old, dead red blood cells. So of course we're going to have an area with red blood cells. That's where that red pulp comes in, because there we are filtering out those red blood cells. So blood enters the spleen at the white pulp. We have B and T cells that are going to kind of monitor that blood as it's coming through to help with different immune system functions. The red pulp is our macrophages are going to get rid of, engulf those red blood cells, break them apart. We also can store platelets in that red pulp. Our spleen is actually a site of of blood cell development in a fetus. So here is a spleen. It sits on the upper right side by the stomach, sort of. It's a pretty hard organ. If you've ever seen it in a cadaver, it's pretty hard. But we've got lots of veins and arteries that come throughout. You can see all the red pulp, which is just the red areas. The white pulp is going to be the white areas. They're named for what color they stain. So what happens when a spleen ruptures? It can happen if somebody has some sort of contact, severe blow, as your book says, to the left inferior chest or superior abdomen. Breaking of those lower ribs can actually rupture the spleen. The lower ribs are there to actually help protect your spleen. Because our spleen is cleaning out red blood cells, that spleen ruptures, it could cause hemorrhage. That is a lot of blood being lost, which results in shock. You lose too much blood, your body doesn't know how to react to it. You need to remove that spleen to prevent death. The red bone marrow and liver, because remember from the blood chapter, the liver also helps to clean out old dead red blood cells. So the liver can help pick up some of those functions. The problem is our immune functions will go down if we don't have a spleen. They're at higher risk of sepsis, which is blood infections, because that spleen is monitoring that blood for infections as that blood goes through. So patients usually have to take a prophylactic antibiotics before any type of surgical procedures that is invasive. So they're cutting in to help prevent sepsis from happening. So these lymphatic nodules. Lymphatic nodules here, they're masses of lymphatic tissue that are not surrounded by a capsule. We have quite a few of them in that digestive system, urinary, genital system. These are mucus-associated lymphatic tissue or lymphoid tissue, known as MALT. We have a lot of these around. As I mentioned before, Peyer's patches. These are found around mostly the ileum, that's part of the small intestine, and the appendix. We have a lot of that mucosa-associated lymphoid tissue. Our tonsils are lymphoid nodules. Technically, there's 5. And anything that is ingested, so anything, well, inhaled too. So you breathe in or goes in through your mouth, your tonsils are making sure that we are trying to protect you from any type of bacteria or pathogens that are coming in through this route. We have the pharyngeal tonsils. They're also known as adenoid. They are on the back of the nasopharynx. So they're at the back of the nose. That nasal cavity, the very back of that cavity, is the pharyngeal tonsils. The palatine tonsils, these we have 2 of. They are at the back of your throat, that oral cavity. And then lingual. Lingual is for tongue. So they are in the back of the tongue. People who or kids that get strep throat a lot, who get inflamed tonsils and that it almost cuts out their opening down. They have a hard time breathing, swallowing, everything. These are the most commonly removed. A tonsillectomy is the removal of tonsils. Tonsils, and ectomy means to take something out. So tonsillectomy, we're taking out tonsils. It's better to do it as a child. I had a patient who had it done in her early 40s, and she said it was the worst surgery she has ever had, and she had 4 kids. So, and it was worse than having the 4 kids that she had. So tonsillitis, itis is inflammation. So tonsillitis is an inflammation of those tonsils. That inflammation could be caused from an infection. It's usually viral, sometimes bacterial, because strep throat is technically a bacterial infection. But that's usually what causes enlargement of your tonsils. You can have a sore throat, you can get a fever, those swollen lymph nodes in that area, nasal congestion. You have a hard time swallowing. You also get a headache sometimes with these. That's where that tonsillectomy, the removal of your tonsils, can come into play. People who don't respond to other treatments, or they have long lasting, like more than 3 months of tonsillitis. The interesting thing is removing those lingual tonsils does not interfere with your immune system to be able to protect yourself from other future infections. So our lymphatic tissue starts developing around the end of the 5th week already of embryonic life. It starts very early. They start from what is known as lymphatic sacs. The first sacs appear are the jugular lymphatic sacs. Then we get the retroperitoneal lymphatic sacs. This means they're back behind most everything else in the body. Then we also get the cisterna chyli. It's below the diaphragm. The last ones to develop are the posterior lymphatic sacs. Those come from the iliac veins. They start to mesenchyme tissue, that prenatal connective tissue, kind of comes in and groups around it and eventually forms different lymph nodes. Your spleen comes from mesenchyme tissue completely. Even that thymus, it comes from a pharyngeal pouch. So if we look, here we show it in red. We start with this jugular lymph sac, this cisterna chyli, the retroperitoneal lymphatic sac, and then the posterior lymphatic sac. Then all of the red that is coming out from there are those different lymphatic vessels that are starting to grow out to go everywhere in the body. So now we're going to start looking at disease resistance. We'll get through the first part of disease resistance in this video, and we'll finish it up in the next video. So our first line of defense, we have our body contains different lines of defense against the outside. That's our innate immunity. This is what we are born with. Your skin. Your skin acts to protect you from anything going directly inside of you. That's your skin is there as a primary physical barrier to stop microbes from getting in, and we're shutting off layers of our skin all the time. So that helps to remove any microbes from our skin, our system. It's very hard for bacteria to actually get through healthy skin. They can get through cuts, burns, punctures, but they cannot get through, they have a very hard time getting through that healthy skin. Mucous membranes, we mentioned those in Anatomy 1 in the tissue chapter. These are places that secrete out different types of fluids. Fluids are going to trap microbes and transport them back out of the system or kill them, one or the other. Because we have mucous membranes in our nose and our hair. They help to filter out and prevent different microbes from getting in. That upper respiratory tract that has that pseudostratified columnar epithelium with lots of those goblet mucus cells secrete out lots of mucus. And that mucus is there to catch any pathogens. And then that cilia on those cells help to push that mucus towards the back of the throat, which is what causes you to cough. Your eyes have that lacrimal apparatus that's going to drain tears away from your system. Those tears have what's known as a lysozyme. Lysozymes break down bacteria. Our saliva, when we swallow, if we have microbes that we've kind of ingested, it takes them down into your stomach, which is a very acidic environment. So there's other things that our body uses to keep foreign substances out. Urine is pretty acidic. So urine, through that urinary system, it prevents microbes from growing too much. It prevents overgrowth of specific microbes in that urinary tract. In females, vaginal secretions help to move microbes out of the body. Defecation, vomiting, or vomiting is a quick way to expel microbes. Defecation, that's another way to get rid of them. Sebaceous glands, we have those on our skin and our hair. The oils that are secreted creates this film over our body that has certain qualities to it that prevents the growth of specific pathogens, bacteria, fungi on our skin. Sweat, that perspiration. It helps to wash microbes off of our system. Kind of get rid of them all. And then gastric juices from our stomach. It's so acidic that it destroys the bacteria and toxins, most toxins that get into our system. So our second line of defense, this is more our immune system, but it's different things that prevent microbial growth. So our system has a lot of antimicrobial substances. Some of these white blood cells, those lymphocytes, macrophages, and fibroblasts, if they get infected with viruses, we have these interferons. They're going to actually diffuse to neighboring cells. And these neighboring cells are going to make this antiviral protein that'll try to prevent the virus from replicating in the cells next door. We want to stop these viruses because viruses, when they invade our cells, They use our materials, our cell's materials, they wear out that cell, and then they burst that cell open. So these interferons actually get released out to neighboring cells to try to, we make these viral, antiviral proteins, they go into that cell that has that microbe or that virus in it and try to prevent this virus from replicating. So viruses can still get into that cell. They just stop them from actually replicating and making more copies of themselves. We also have some inactive proteins that are found in our blood. We have some of them on different cell membranes that are known as the complement system. They remain inactivated, but if something were to activate these proteins, they're known as complement proteins because they enhance immune reactions. They can cause cytoburst or cytolysis. Lysis is to break something down. Cyto is for cell, lysis is to break or burst or break down. So they cause this cytolysing of any microbes that may be found in our blood. That phagocytosis. So those cells that come in and eat, engulf these different blood cells. They can also contribute to inflammation because inflammation brings immune cells into that area. Iron binding proteins. Iron binding proteins, their job is to inhibit the growth of bacteria. If we reduce the amount of iron that is available, some of these different microbes need iron to be able to replicate and to do their job. So if we reduce that amount of iron available, then they can't use it. Transferrin, lactoferrin, ferritin, hemoglobin, we reduce the amount of available these different proteins, and it prevents certain bacterial growth. Antimicrobial proteins, or AMPs, or antimicrobial, yes. These are peptides, which are few amino acids. And they have antimicrobial qualities as well, like dermacidin, those are found in our sweat glands. That helps to prevent bacterial overgrowth on our skin. Defensins, cathelitisins, these come from neutrophils, macrophages, thrombocytin, platelets produce these. So they can attract these dendritic cells and mast cells to the area to help participate in different immune responses when we find cells that may have been infected, or we find specific microbes even in the area. Natural killer cells. Natural killer cells are non-specific. They are lymphocytes. They come in and just attack. They are the first cells usually to that area, and they will go after any pathogen that may have gotten into our system. They are that first ones that come in, first line in that army that's attacking. Those are those natural killer cells. They have different ways of breaking down these cells. They can attach to a target cell that's been infected, and they release Perforin. Perforin creates channels in that membrane, which allows fluid just to flow out of that cell, and that cell eventually will burst. Or no, fluid flows in. Too much fluid flows in, it bursts. If fluid were to flow out, it would shrivel and shrink. So perforins produce holes in that cell to allow fluid, just plenty of that extracellular fluid to flow in, and till that cell just becomes too large and just explodes. Granzymes. These are digesting enzymes. And they cause that target cell to go through apoptosis, just to die. So that whatever pathogen may be hiding or using our cells' materials will just come in and die. That cell will no longer be effective in that new cell's job. Then those phagocytes. Phagocytes are also nonspecific because they just come in and they perform that phagocytosis. So they come in and ingest or eat those specific microbes. Those are those neutrophils, those monocytes. They're the two that can phagocytize. So when they find, or when an infection happens, these cells can migrate out of the bloodstream. That's that emigration. When monocytes leave the bloodstream, they are known as macrophages. They start wandering through the cells. They are wandering macrophages. They can be resting macrophages. We have lots of different types of phagocytes around our system, or different macrophages, and they work to just engulf any kind of foreign invaders into our system. So phagocytes are going to go through 5 phases. Chemotaxis. Chemotaxis is when they just move and between the cells and get to that site of infection, damage, whatever might have happened. We release specific chemicals. If there's tissue damage, these cells release out specific chemicals that bring these phagocytes to the area. They come in and engulf any kind of foreign particles, any invading microbes, even just damaged cells, tissues, they engulf it all. Adherence. This is when a phagocyte actually attaches to a microbe or particle. This is where complement proteins can actually enhance the binding of these phagocytes. Then that ingestion. The plasma membrane of that phagocytic cell kind of projects out, and it causes what is known as pseudopods to come in. So we have this macrophage. This macrophage is going to kind of come out and it kind of wraps around. Now that looks like a tooth. And whatever microbe or whatever may be here, it kind of wraps it around. These are pseudopods, these projections that come off or wrap around to come around and eat up that microbe. They kind of fuse in together. Digestion. Well, they're going to break that down. So they can use their lysosomes to break the cell wall of whatever microbe. They have digesting enzymes because they want to break down carbohydrates, proteins, lipids. They want to break all of it down. They also want to get rid of any lethal oxidants, superoxide, hypochlorite, anions, or hydrogen peroxide, because those are dangerous to our system in high numbers. Then they kill. So those lysozymes, enzymes, different oxidants, they kill those microbes. That is their job, phagocytes. So here's those pseudopods that I was trying to draw. They have this microbe coming in, it wraps around, it kind of makes a vesicle. It's known as a phagosome, but it looks just like a vesicle. So it's going to connect to these digesting enzymes, which are going to break everything down. And it's going to break it all into smaller pieces. And this video kind of goes through and animates how this process happens. So microbial invasion of phagocytosis. So some microbes, like pneumonia, have different structures. They have like a specific capsule that wraps around even their cell membrane. So it kind of prevents them from being phagocytized. Some microbes that produce toxins, like toxin-producing bacteria, like food poisoning. Food poisoning is because of bacteria that produce toxins. They may be able to be ingested by phagocytes, but we can't kill those. They start to produce toxins that can actually kill the phagocytes, these toxin-producing bacteria. These bacteria have evolved a lot just because of how our system fights things off. They have to find new ways to fight things. Other microbes like tuberculosis, they can inhibit phagosomes and lysosomes. So it can actually inhibit, it can prevent them from being exposed. So there's a lot of bacteria have found ways around our immune system, which makes it a lot harder to get rid of. Inflammation is another nonspecific response. As I had mentioned before, inflammation, some of the can be caused by pathogens, can be caused by some sort of abrasion, chemicals, chemical irritations. Extreme temperatures can cause inflammation. It is your body's way to get rid of pathogens, get rid of toxins. It is used to help prepare that specific site for repair. There's different signs associated with inflammation. Prish. So we usually get pain. The pain is because chemicals are being released. Chemicals get released because it brings some of these white blood cells to the area. We have redness. More blood is rushing to that area because all those chemicals that may have been released because of that tissue damage. Immobility. If it gets too swollen, you may not be able to move that specific joint or area. That's where that swelling comes in. Too much fluid accumulates in that area, it can cause that joint to not be mobile. It also brings heat to that area because heat is carried in the blood. If heat is carried in the blood, when more blood comes to the area, it's going to heat that area up. So inflammation is a non-specific defense mechanism. If we have a cut, our immune system is going to act in different ways. We're going to vasodilate those blood vessels. So we bring in more immune cells. That emigration of phagocytes are going to leave those blood vessels and go into those tissues. And then that tissue is going to repair itself. So we've got tissue injury here in our skin. We have a microbe. These little microbes that have come into our system. We have our different phagocytes that have left the bloodstream. They have gone through emigration through those tissues to find these microbes that have gotten in. They are phagocytizing, they are engulfing all of these different microbes into them to break them apart to prevent us getting any kind of illness of any kind. So vasodilation. Vasodilation increases the size of those blood vessels. It also increases the permeability. Those blood vessels, especially those capillaries, as they get larger, it creates more openings for different things to get in and out of that specific capillary. So things that normally stay in the blood can actually get into or out, like proteins, defensive proteins specifically. And it gets rid of microbial toxins. So histamine. Histamine comes from mast cells. Mast cells tend to sit in connective tissue. Basophils are another type that release out histamine. Platelets can even release out histamine. Histamine is one of those chemicals that gets released out that actually attracts those phagocytes, those neutrophils and those macrophages to that area. Histamine also causes vasodilation of those blood vessels. Kinins. These are polypeptides. They sit in the blood in an inactive form. And they're also going to induce vasodilation. They help to increase permeability of those blood vessels. And they are chemotactic agents for phagocytes. So they help to bring those phagocytes into the area. Prostaglandins. These are any cells that get damaged are going to release out prostaglandins. And they cause any effects of histamine and those kinins to intensify, get larger. So it causes more of a reaction to that. And it causes more that emigration of those phagocytes into those tissues. Leukotrienes. This is a substance that comes from basophils and mast cells. And again, they increase the permeability and function of those phagocytes. They get those phagocytes to the area, they attract them into there, and they cause those phagocytes to fully engulf. Complement. That stimulates histamine release, which brings neutrophils to the area to help promote that phagocytosis. These are all different chemicals that are going to be released out at any type of tissue damage. So what happens? What are signs that we see during inflammation? Well, we're going to see heat, or we can feel heat usually. We see redness and we see swelling. So this heat and this redness is because of all the blood that is coming to that area. All the blood vessels in the area have dilated because not all of them are always open, allowing blood into that area. So all of the blood vessels in that area have opened up and they're allowing blood to travel into more blood to travel into that area. We get that swelling, or what is known as edema. That edema is bringing more and more fluid to that area. And it's because of all of the blood vessels that have increased their permeability. So that fluid is now leaving the bloodstream. Pain, we can experience pain. And it's because we could have injury to neurons. It could be from toxic chemicals that those microbes that have gotten into our system are releasing. So those phagocytes that have entered our bloodstream or entered our tissues, they enter through that emigration. It happens within an hour when after that inflammatory process begins. They go through chemotaxis, and that just helps them travel through the tissues to their specific target area. Those neutrophils are going to try to attempt to destroy the microbes through that phagocytosis. They come in and engulf. They try to break things down. Neutrophils coming into that area, lots of neutrophils causes leukocytosis. Neutrophils are usually the first ones into the area, but they die off pretty quickly. Monocytes are the next ones. When they leave that bloodstream, they transform into those macrophages. They help with that phagocytosis. They're more potent. They can kill more things than neutrophils can. Neutrophils start, monocytes come in as macrophages, and they continue. Those macrophages are eventually going to die off. Eventually, we end up with a pocket of dead phagocytes and damaged tissue. That's what pus is. Pus are those dead phagocytes and damaged tissue that is being removed from the area. And it's going to continue until any infection that may be in that area has finally left. Acute inflammation, that is something that comes on rapidly. It starts like right away, and it can last for a few days to a few weeks. Less than 1 day to like the end of 2 weeks, technically. Chronic inflammation, it develops very slowly, and it is technically anything change that. That's actually the end of 2 weeks or 3 weeks. Because anything that is considered chronic is usually 3 weeks or longer. Because your system should come in and get rid of that swelling, get rid of those signs of inflammation as everything starts to heal. If that is not happening, it can turn into chronic inflammation. If it does not go away after those 3 weeks, it is considered something more chronic. A fever is another way your body tries to help fight off pathogens. A fever is technically an abnormally high body temperature because the hypothalamus that sets your body temperature gets reset. It gets reset to a higher temperature than what is normal. So during infections and inflammation, it's pretty common to get a fever. And what happens is these bacterial toxins that get into your system, they can reset that hypothalamic thermostat. It can be triggered by the release of fever-causing cytokines, interleukin-1 from macrophages, can reset that hypothalamic thermostat. That elevated body temperature can interfere with interference. We're trying to inhibit the growth and the spread of those microbes. And it actually speeds up body reactions to help repair the system quicker. So fevers are not always bad. That is a very common misconception. Fevers can be good because it's helping to prevent the growth of any certain bacteria. They can grow at normal body temperature. If our body resets our temperature higher, it may be too high for that microbe and it kills them off. As long as the fever doesn't get too high, it's usually over 103 for an adult, 100 and even for a child for an extended period of time. Having a high fever can be dangerous, like too high of a fever, but like a low grade fever is not always bad. It's your body's defense mechanisms trying to fight off specific pathogens. So these different lines of defense, our first lines of defense here. These are all the different types of first lines of defense that we have. Our skin, mucous membranes, that mucus alone, the hair, the cilia, that lacrimal apparatus for your tears, the saliva, the urine, the defecation, the vomiting, even the different secretions. That's second line of defense. Those interferons, that complement system, those iron binding proteins, those antimicrobial proteins, those natural killer cells, phagocytes, inflammation and fever. They're all working to try to help kill off anything that has gotten into your system. Abscesses and ulcers. An abscess is when pus cannot drain out of an inflamed region. That forms an abscess. So pus kind of accumulates in that area. A pimple is an example of an abscess, even boils. So an ulcer is where that tissue, like superficial tissue in an organ sloughs off because of something, and you end up with like an open sore in the area. People who have poor circulation are more susceptible to ulcers. Atherosclerosis, that causes poor circulation. That can even lead to more types of ulcers. Okay, this is the end for part 1. We will continue on with part 2 in the next video. Thank you for listening.